A Texas neurosurgeon is facing life in prison for botched spinal surgeries and 2 deaths. Critics say that could have been avoided. Some feel this sentence is extreme. Others think it fits his quote-unquote crime. I have to say, when I read the story, I was heartbroken for so many different reasons. There's nothing in this story that should make anyone feel good, because there's really no debating that there were botched surgeries and that patients
had poor outcomes.
What's really hard is to listen to the testimony of the surgeon's family, and also the mental state of when you're in a high-stakes surgery and you know it's not going well. You know how we always say it's not brain surgery? Well, in brain surgery, when things don't go well, bad outcomes can happen. Neurosurgeons are actually, every neurosurgeon, there's a 19% chance every year that a neurosurgeon will get sued. It's the highest risk medical specialty.
Really?
Neurosurgery now is a 7-year residency program, the training. My son is a neurosurgery resident now at Northwestern. He is working with his attendings for 7 years. If he was that bad a surgeon, they would have never allowed him to complete his training. That's one thing. And then he's working in a setting doing these complex spine cases. Number one, in spine cases, there's always a chance that things are not going to go well.
High risk
back problems are so difficult to treat anyway, but especially surgically, we know that outcomes are iffy. So he's doing these surgeries in the hospital with anesthesiologists watching, scrub nurses, and assistant. If there was something that was that egregious, that bad about what he was doing, somebody would have
Well, here's where things get really interesting, and to me very sad, is even the attorney argued that, look, he was a bad surgeon, feels remorseful for his actions, but didn't act maliciously. And that's why I really am struggling with the concept that this man is going to spend his life in prison, when I have a feeling he just wanted to do his best, and he was struggling in the operating room and should have walked away from the profession, done whatever. But there's so much pressure in that OR. And my biggest concern when I read this was that, boy, why would you, becoming a doctor all of a sudden, if you know you could spend life in prison because of a bad patient outcome? I mean, negligence needs to...
This case really sets a precedent.
It sets a precedent. Just a few weeks ago, we talked about a midwife who had delivered thousands of babies, and a baby died in her care, and she was sent to prison. If we're starting to... This is a game changer in terms of how we're starting to sentence negligence, which is it's gone from monetary rewards to now sending people to prison. And and
the system is in place there. If there is a less than optimal outcome, that's why there's civil suits, that's why there's malpractice insurance.
But
it's in place for that, but throwing him in jail, life imprisonment, I mean, I'm not convinced the intent was there. Maybe he took on very difficult cases.